Hi, I'm Dr. Mark Shelley, a chiropractic physician and board-certified functional neurologist. I practice at Olympic Spine and Sports Therapy located in Edmonds, Washington. I want to thank you for taking time to view our neuropathy video series. In over 30 years of practice, I've literally had thousands of patients describe their symptoms to me. Many will experience tingling or numbness in their hands or their feet. Some will have stabbing, shooting, or burning pain. Others experience reduced balance and difficulty walking, and it limits their activity. All of these symptoms have one thing in common: they rob neuropathy sufferers of their quality of life. What makes it worse? Most have been told there's no way to find relief outside of taking drugs, and that just masks the pain. I want you to know that's not always the case, and masking the pain with drugs doesn't prevent the progression of nerve damage. At Olympic Spine and Sports Therapy, we use a combination of up to 8 different treatments to rehabilitate the damaged nerves. We use treatments like non-invasive laser and balance therapy that are customized for each patient. All of our treatments are non-drug, non-surgical, and pain-free. Best of all, for the patients that qualify, they're highly effective. In this video series, we want to give you a good overview of neuropathy, including the symptoms and causes of peripheral neuropathy, the common medical treatment for this complicated condition, and of course, we'll go in depth on the comprehensive treatments that we use to rehabilitate our patients' damaged nerves and help them regain their quality of life. If you or someone that you know is suffering from neuropathy, I hope you find this video series helpful to better understand the condition and your treatment options. Thanks for watching. Neuropathy simply means that the nerves are not working properly. The National Institute of Health estimates 20 million people in the United States have some form of peripheral neuropathy. More than 100 types have been identified, each with its own symptoms and prognosis. There are some telltale signs that nerve damage has occurred. The symptoms can generally be grouped into 2 basic classifications: negative and positive symptoms. Some patients describe what are classified as negative symptoms. This includes sensations like decreased sensitivity, numbness, tingling, or feeling like their hands or feet were dead or asleep. If the condition is allowed to progress, reduced sensation can become dangerous as balance becomes impaired and risk for trips and falls increases. Other patients experience what strangely enough is categorized as positive symptoms. Positive symptoms include strange but distinct sensations like burning, stabbing, electrical shock-like pain, or feeling like their socks were balled up underneath their toes. As neuropathy progresses, symptoms often become more severe and have a growing impact on a patient's quality of life and often on their family. Standing and walking can become difficult and limited. Ultimately, independent mobility can be threatened. Some neuropathy sufferers are forced to rely on walking aids, progressing from a cane to a walker, then ending up in a wheelchair. It's important to begin treating neuropathy early to prevent it from progressing to the point that rehabilitation is no longer possible. Thankfully, due to advances in neuroscience and technological breakthroughs, now many neuropathy sufferers can slow or stop the progression of their condition. With treatment, many patients experience relief of pain, restoration of balance, strength, and mobility. We're able to help many neuropathy patients regain their lost quality of life. The advanced, comprehensive treatment procedures we use are drug-free, pain-free, and best of all, for many neuropathy sufferers, they're highly effective. The most common cause of distal symmetric polyneuropathy in Western countries is type 2 diabetes, resulting in what's classified as diabetic nerve pain. Other known causes can range from vitamin or mineral deficiency to chemotherapy drugs, among many others. Many cases of neuropathy, however, are considered idiopathic, meaning the cause is unknown. This can be extremely frustrating for patients and doctors alike. Most neuropathy sufferers come to us because they haven't been helped with standard medical treatment. Many have been told there's nothing that could be done to treat their condition. They just have to live with it. Some were given prescriptions for medications that produce side effects that were worse than the neuropathy. Medications frequently prescribed for neuropathy include anti-seizure prescriptions like gabapentin, anticonvulsants such as Lyrica and pregabalin, serotonin reuptake inhibitors including Cymbalta and duloxetine, and opioids like tramadol and oxycodone. These medications come with a laundry list of symptoms that can accompany their use. At this time, there is no drug that can restore lost sensation or improve impaired balance caused by peripheral neuropathy. Taking medication is not going to rehabilitate the nerves. As numbness and tingling progress, position sense and stability often deteriorate. Inevitably, the consequence is increased risk of falls. It's no wonder neuropathy is so frustrating for patients and physicians. It's the same reason patients who qualify for our treatments are so thankful that they found us, because our treatments are effective for so many neuropathy sufferers. Fortunately, advances in neuroscience and breakthroughs in medical technology have provided us with drug-free, non-invasive, safe, and effective treatments that have helped thousands of neuropathy sufferers. Determining if a patient is a candidate for our treatment is simple. The first step is to schedule a consultation free of charge. During the consultation, our doctors will screen for conditions that would rule out treatment. If medical management is necessary, we want to quickly get you to the correct provider. Then, a series of tests will be conducted to determine the extent of nerve damage and whether or not you're a candidate for treatment. Even with our comprehensive treatment approach, if the neuropathy has progressed too far, conservative treatment may no longer be an option. Next, the test results are assessed to determine how much improvement is likely. Each patient's condition is unique, as is their treatment. The underlying cause, extent of nerve damage, and overall health of the patient all contribute to how well and how quickly someone will respond to treatment. Providing realistic expectations for all of our patients is a top priority. Patients are then presented with a treatment plan that outlines the type of rehabilitation methods that are recommended for them. The comprehensive treatments used in our clinics typically take from 45 to 90 minutes. Generally, clinic sessions start at 2 to 3 days per week, then reduce to 1 day per week. Patients are also given instruction on how to support their in-office treatment at home. It's optimal for patients to perform their home care procedures 2 times per day. Each session typically takes between 15 and 20 minutes to complete. Although the primary treatment procedures we use, like high-dose Class 4 laser, non-surgical decompression, and infrared therapy are FDA cleared, most insurance companies do not cover them. Unfortunately, insurance is designed to pay for drugs and surgery. Most of the patients that come to us to rehabilitate their nerves, not just mask their symptoms, are willing to incur personal expense to get effective treatment. Your free consultation will give us information to determine if you're a candidate for treatment, and if you are, how much treatment you will need, all before you incur any expense. Peripheral neuropathy rehabilitation plans are customized to each patient's treatment needs. Treatment plans may include infrared, high-dose laser, vibration, and balance therapies, nutritional supplementation, spinal decompression, manual therapies, and lifestyle recommendations like sleep, diet, exercise, and stress management. Each therapy serves a specific purpose and complements the other treatments to actually rehabilitate your damaged nerves. The goal is not just masking your pain or giving you temporary relief. Fuel and activation is the mantra in functional neurology. Fuel for nerves is glucose and oxygen. Activation is exercise. Our comprehensive treatments are designed to feed the nerves and exercise them. Infrared light therapy directly increases circulation to the nerves and other local tissues. This reduces inflammation, increases delivery of nutrients such as glucose and oxygen. Studies have also shown that infrared light can be beneficial in healing damaged arteries and nerves. Infrared therapy is typically applied using a boot to cover the foot and pads to cover the back of the legs. Hands and arms can be treated in a similar fashion. Clinical studies and research using laser therapy have demonstrated reduced pain and inflammation, as well as stimulated nerve regeneration, muscle relaxation, and improved immune system response. Our body can benefit from absorbing certain frequencies and wavelengths of light, similar to the way plants benefit from sunlight and use it to grow. Our bodies absorb near-infrared light and convert it into ATP. High-dose laser therapy is a powerful weapon in our arsenal to combat neuropathy and rehabilitate nerve endings. Vibration therapies are used in our treatment of neuropathy. Whole-body vibration therapy has been used for the treatment of pain, for rehabilitation, and to enhance athletic performance. Studies have demonstrated benefits such as increased muscle strength and endurance. Because the muscle fibers are activated up to 20 to 50 times per second, this allows muscle fibers to be exercised rigorously in a short period of time. The rapid contraction of the muscles produces a pumping action that increases circulation, enhancing the removal of cellular waste, and it also improves the delivery of nutrients. The treatment program works by creating an environment that supplies adequate oxygen and maintains healthy, stable levels of glucose. Specific supplements can be beneficial for nerve repair in certain conditions. We use a combination of supplements in conjunction with our therapies to accelerate the healing of damaged nerves and blood vessels, promote the activation of nerves, and reduce inflammation and oxidation. When neuropathy suffers, lifestyle factors can play a very important role in recovery. This is why our doctors may address sleep, diet, exercise, and stress management considerations. The single greatest source of activation for our nerve system comes from receptors in our muscles called muscle spindle fibers. Every time a muscle is stretched, the muscle spindle fires a signal activating the nerves. This activation is essential for nerve health and longevity. Physical exercise has been shown to improve balance of patients suffering from peripheral neuropathy. The appropriate activity and exercise recommendations can greatly impact the degree of success a neuropathy patient experiences. Joint mobilization and adjustments can restore lost mobility, improve muscle function, and increase the activation of nerves. Some patients come to us with both distal symmetric polyneuropathy and nerve compression. Clues to this combination of conditions are symptoms that are noticeably more severe on one side than the other. More obvious clues are having back and neck pain that accompanies symptoms of neuropathy in the hands or feet. Patients with nerve compression often require spinal decompression in addition to peripheral neuropathy treatment. When conservative measures have failed, the standard medical treatment for spinal nerve compression is decompressive surgery. Most medical experts agree that back surgery should be a last resort. Instead of surgically removing disc material causing pressure on nerves, non-surgical decompression uses a sophisticated machine that gently stretches the spine, creating negative pressure inside the disc. This draws bulging disc material back into place. Non-surgical spinal decompression is another invaluable treatment available in our drug and pain-free treatment approach. Unsteadiness when walking, feeling dizzy, tripping, and falling are signs of balance problems. According to the CDC, roughly more than 1/3 of adults aged 65 years and older fall each year. Preserving independence in activities of daily living and mobility is a chief concern for our neuropathy patients. Balance therapies tailored to each patient are a key component of our comprehensive treatment plan for every peripheral neuropathy patient. Many of our neuropathy patients say the greatest benefit they receive from treatment is regained confidence in their ability to walk, the ability to return to a vibrant and active lifestyle. In addition to the in-office treatments for peripheral neuropathy, each patient is trained how to perform home therapies. These home treatments become the foundation for maintenance therapy. Patients are assigned simple at-home exercises like thermal contrast exercise, mechanical nerve stimulation, sensory motor coordination, and balance exercises. We've covered a lot of information. I want to thank you for taking time to learn about peripheral neuropathy and your treatment options. There are 3 things I really want you to take away from this video. The first being, don't put off getting evaluated. We can help most neuropathy sufferers if they start treatment before it's progressed too far. The second, medications only mask your symptoms. They can't prevent the progression of your condition or improve balance. The third, we've helped thousands of patients with neuropathy. Don't accept that you just have to live with it without first being evaluated. Our comprehensive treatments can help rehabilitate damaged nerves, reduce symptoms, improve balance, and help neuropathy sufferers regain lost quality of life. If you're suffering from any of the symptoms of neuropathy, tingling or numbness in your hands or your feet, stabbing, shooting, or burning pain, or impaired balance, call the number on your screen and schedule a free consultation. We'll evaluate your condition and let you know whether or not you're a candidate for our non-surgical, non-drug, pain-free therapies. Your consultation is free of charge and could completely change your quality of life. I look forward to seeing you at our office. Thanks again for watching.